Welcome, all of you. Good turnout. I'm Fred Cummins. I'm president of the Alliance for the Mentally Ill Oakland County, and started putting this together with a number of other people, some of whom you'll be hearing from shortly. Little background, just so you know why I'm here. My wife and I hope have been advocating for the mental health system for probably 30 years. My daughter is seriously mentally ill from age 17. She's now 49. And she's currently unable to obtain services. She needs to recover from a head injury, basically because of funding. So why are we here? Basically, the public mental health system has been going downhill for several years, basically due to restrictions on funding. People are experiencing reductions in services. Some people have lost services. Direct care providers are unable to hire needed staff. In January, the minimum wage goes up again, and there's another increase. There's no budget increase to cover that cost. People can make more with less demanding jobs, like Kmart and McDonald's. Last spring, the governor submitted a budget with, which we'll hear about in Section 298, that proposed to enable transfer of Medicaid mental health funding from CMH to HMOs. Basically, we call that privatization. It's almost all of the budget of $2.4 billion. There was major public reaction to that section. A very large turnout to the public hearing in Lansing, and the legislature withdrew that section. And there was another committee formed that Mark, who talks a little bit later, will talk to you about that, to talk about how this is going to have to be reformed. We consider that the mental health system is in a crisis, but there are many reasons the privatized system will not solve the problems. And if you saw, there's a handout on the table outside that outlines a number of the reasons that we're concerned about privatization. This forum is to make our legislators aware of the serious problems of the current mental health system and our concerns for reform. This is intended to be a nonpartisan effort to reform, and legislators, since legislators rely on the administration to determine the needs of the mental health system, we want them to hear more from the people who rely on that system to provide their guidance on how to deal with the budgets and priorities. This forum is also intended to make the reform of the mental health system an election issue, which is why we're doing it now. We're hoping that you'll leave this forum and you'll be talking to legislators about your concerns and candidates. So we want this to be a discussion before the election and after the election. We found widespread support for this forum. And if you looked at the flyer, I thought I would have one here, but if you look at the flyer we've handed out, there's a large number of organizations that has supported us. That's been growing day by day, and each time we publish a new copy of the flyer, it gets a little longer. But there's a lot of support, and the flyer announces that there are 2 other forums that will be coming up in Macomb and Wayne. And in fact, there's a couple other kind of subsidiary forums that are going to happen in northeast Detroit and in Monroe County. And we can tell you more about those. We don't have the flyers for those, but they'll be available. So, let's start with our panel, which is growing. And just let them introduce themselves and the district or whatever they represent or are running for.
Good evening, everyone.
Good evening.
Good evening. Thank you. My name is Robert Wittenberg. I am a state representative, and I have some fans in the audience, of course. Thank you. I am the state representative. My district is just south of here, so it's Berkeley, Huntington Woods, Oak Park, Ferndale, Pleasant Ridge, Hazel Park, and Royal Oak Township. So not Royal Oak, but it's the township. And I am serving in my first term and running for my second term. So I'm interested to hear what everyone has to say this evening. Thanks for having me.
Good evening, everyone. I'm Christine Gregg, and I represent, I'm the state representative for District 37, which is Farmington and Farmington Hills. I'm also finishing up my first term and running for re-election. I sit on the Education Committee, Workforce and Talent Development, and Communications and Technology, but I'm really proud of the caucus work I do. I was one of the founding members of the Disability Awareness Caucus, a bicameral, bipartisan group of legislators trying to improve our policies.
Hi, good evening, everyone. My name is James Young, and I am running for State House District 37. Also, in that same race, and I just happen to be the Libertarian candidate in that particular race. And once again, District 37, State House District 37 is Farmington and Farmington Hills. Thank you very much for having me.
Good evening, I'm Cindy Peltonen. I live in Clawson, and I'm the Democratic candidate for State House representing Clawson and Troy.
Yeah. That's a good start. We got lots of room for more to come. We got somebody coming?
Yeah.
Everybody else introduce themselves.
Hi, good evening. How are you today? Good. Such a great crowd. I'm glad you guys are here. It's an important topic. My name is Clint Kesto. I'm a state representative out of Commerce Township. I represent West Bloomfield, Wixom, Wolverine Lake. In my second term, I sit on health policy. I chair the Judiciary Committee. And be sure you can always contact my office. I see many familiar faces, and we're happy to do everything that I can within my power. So thank you for inviting me.
Thank you. So now we're going to hear from our advocates, particularly some people who've been instrumental in making this happen. Let's start with Nick Ciamatero, a former legislator from years past and an advocate for mental health services.
I appreciate the opportunity to be here. I helped with the work group that put this together because of the concerns surrounding the decreasing resources available for mental health care in the state and the current proposal to try to shift that responsibility from the public sector to insurance companies, to HMOs. By way of background, my name is Nick Ciamatero. I'm Director of Legislation and Public Policy for Michigan AFSCME Council 25, which is a statewide group. But full disclosure, I also am a member of the Macomb County Community Mental Health Agency and its PIHP, or Pre-Patient Inpatient Health Plan. Greetings. So members and candidates and ladies and gentlemen, I appreciate your being willing to come here and share your stories with the people who want to work for you, the candidates for election and re-election to the Michigan House of Representatives. As Fred mentioned, I was in that position. I served for 20 years in the Michigan House of Representatives, 18 of which either on the Standing Committee on Mental Health or the Appropriations Subcommittee dealing with mental health funding, and ended my tenure as director, or as chairman of the Community Health Subcommittee of the House Appropriations Committee. The proposal that brings us here, well, there are two things that bring us here today, as the flyer indicated. The first is concerned that there are insufficient dollars available for mental health services in the state, period. We have over the years shifted our emphasis on funding from the state's general fund and county funds to almost exclusively Medicaid funds. And that's not entirely a bad deal, because that pulls in a lot of federal dollars, and that's a good thing. And we saw an expansion of that through the Healthy Michigan program that pulls in additional federal dollars. But instead of expanding the services that we'll hear from others tonight are so badly needed, we've contracted other sources of revenue, and that has created a problem. The second issue that has brought us here is a proposal that's been floated in Lansing to take over $2 billion, that's the combined federal and state money that goes into the system, and instead of administering it through boards and agencies that are appointed by elected officials, give the administration of that money over to the hands of what are known as the health plans, or HMOs, private insurance companies. We're very concerned about that because there's a number of fallacies to the question of privatization in this state. The first argument for shifting it is that that somehow would save money. In reality, Michigan has a great deal of experience with efforts to take public services and move them over to the private sector. And in nearly every instance, we have seen that it ends up either costing us more money, and generally always costs us more money. And if it does save any money, that savings is a result to a reduction in public services. I wasn't going to talk too much about this because it isn't really mental health, but Marge prevailed upon me, and you'll hear from Marge later, about some of the examples of how that's happened. Anybody here heard about the problems with food service in the Department of Corrections? That's a direct result of our handing it over from state civil servants to private companies, one of whom has now lost their bid, and will tell you that it is an appropriate use of their time. We contracted with J2S to provide 325 direct care workers, CNAs, to work I'm sorry, I missed it. Go on to the other one. J2S is the second example. See, I'm getting them confused. But in the Department of Corrections, we first went to Aramark. Aramark managed to create such a stir that we're now with a second company, and we're having similar problems, and we actually saw a riot in one of our prisons. The second example, which is the one I started to talk about, I'm sorry, is at the Grand Rapids Home for the Vets, where we replaced, again, state civil service employees with a private company. That private company, J2S, who has now lost their bid because they've breached the contract so many times, was asked to provide about 325 CNAs. They went through 2,000 CNAs in a 2-year period of time. Rapid turnover, and you'll see how that connects directly to the problems that mental health is now facing. We've also seen the problems that privatization has created in the public school systems, and we've seen, I've got a note here on one that I can't even read my own note. The direct care staff, that's the mental health piece, is in the direct care staff problem. We generally, most CMHs, contract with private companies for the provision of direct care staff, whether it's in group homes or in the homes. We are now facing a major crisis of both turnover and the ability to hire people. Fred alluded to that in that field, because the amount of money available from Medicaid is insufficient to pay a living wage, a comparable wage, a market wage in today's economy. And that's a major problem. The second reason that we've heard from the administration, from the public sector, from Lansing, is the suggestion that we might want to do this privatization in order to coordinate physical health care with so-called behavioral health care or mental illness. And that's a laudable goal, and that's something I think we all recognize, particularly in the mental illness area, is needed, since we know more and more that mental illness is indeed a physical illness, a brain illness. And we think that's something that can be reached, but we can reach it without creating the type of problems that outsourcing or privatization creates. And in fact, in Macomb County, utilizing resources that are coming to us from Debbie Stabenow's recent legislation, which we hope will bring some additional dollars into the state, and looking at creating centers that do just that in connection with the federal health care agencies that already exist for physical health service delivery, which would then help to avoid the dangers of shifting the administration of over $2 billion of your money from public oversight to private corporation oversight. Let me tell you what the biggest dangers of those are. I've given you some examples, but let me tell you why those examples happen. And it's not because J2S was a bad corporation or Aramark was a bad corporation, but it's inherent in the very concept of handing over these resources to a private agency. The first is that it loses transparency. Private corporations, unlike public entities, are not subject to the Freedom of Information Act, and they're not subject to the Open Meetings Act. So the decisions that are made on how your money gets used gets done behind closed doors, and the information as to how it's being used is not available to the public. And I'll give you one simple example. You heard me talk about the Grand Rapids Home for the Vets. The original contract said, you know, we were replacing state civil servants who had an average of 12 years experience at the home. Actually, some had 20, 25, 30 years experience at the home. The contract required that everybody have at least 1 year experience at the home. When we asked for proof that the people that were being brought into the home had 1 year experience, we were told that those records were not available to the public because they were held at J2S, the private corporation. We were told by the department, not worried about it, we've kind of looked at it, but we couldn't see those sorts of things. That's the sort of problem and loss of transparency that occurs when we move this from the public sector. The second problem is a loss of accountability. The people who run a private corporation properly are responsible to their board of directors. That's fine when you're dealing with private money. But when you're dealing with huge sums of public dollars, what that means is the administration and the allocation of those public dollars, I know I'm running over time, is private instead of publics. And finally, you'll see an increase, a dramatic increase, we believe, in overhead costs. Private insurance companies have overhead costs of 20 to 30%. CMH in Macomb County has overhead costs of about 6.2%. I didn't want to talk this long, I'm sorry I did, but because I do want to hear from the rest of you, and I know our panelists do, but I just wanted to set the stage on the issues that we need to address. Thank you very much.
My name's Margie Mitchell. I am the head of an organization called the Michigan Universal Healthcare Action Network. We deal primarily in trying to get health care for all, including we are interested in, we believe the head is connected to the body, so we have been very interested in behavioral and mental health also. I also serve on a board in Wayne County that serves 95 adults with developmental disabilities that get their funding from the Wayne County Community Mental Health Authority. I'm here tonight, and I'm just going to make 2 points. One of them is that we need to understand what an insurance company, how they make their money. And how many of you have ever had a problem with your physical health with your insurance company? Yeah. That's right. And I have a personal story I'll tell very quickly. But insurance companies make money and their profits and their administrative fees and everything by restricting services. For example, when I had my first cancer, which was uterine ovarian, they wanted a second opinion. got the second opinion. They wanted a third opinion when my doctor wanted me on the table immediately. And they got me on the table immediately. But I was so angry, I switched insurance companies and complained. The complaining didn't do anything. Goes, well, you know, we had to be sure that you were sick. Well, I left that insurance company feeling that they wanted me to die. Right. That if I died, I wouldn't have cost them any money. Right. And so, you know, remember how insurance companies need to function in order for them to make the money they need to do what they do, including the huge salaries for many people. So that's one thing I want to remind people what insurance companies, how they make their money. The second thing is that this is, from the state level, about not saving lives, but saving dollars. And, you know, we need to remember that it's our money. And we can't allow it to get into areas where we cannot, you know, hold people accountable for their behaviors. And so we really need to remember that this is about saving dollars. It doesn't save anything at all. Because when people get really, really sick, they end up in our most expensive places to get their services. So we need to have people understand that we in communities have the ability to come up with strategies for integrating services and for providing quality services. And if we listen to our community, the quality will grow and we will be accountable to them. So that's really, you know, pretty much what I wanted to say is that I've been around an advocate for over 55 years, and I haven't yet seen anything coming out of the insurance companies that has been something that has been for me. So I think we need to just look at this with a very jaundiced eye, and we need to be really strong in advocating against anything. So I think the next person, is that going to be Liz or Mark?
I'll try to be brief too. I just want to, you know, Nick gave you a big scenario of some of the outcomes of privatization. Margie has talked about some of the insurance companies' practices where they try to reduce their exposure to cost through either directing people to a service of their choice or to no service at all. I just want to remind us that even though our current public system is underfunded and could really use some reforms, our current system is accountable to the citizens of this state. The board members, the PAHP members, the local contract providers are all in the either nonprofit sector or in the public sector where they are governed by persons chosen by our citizenry. If the $2.4 billion goes to the Medicaid HMOs, then they are governed by their boards of directors and their stockholders who have an expectation of profit. And I think we need to know that. We also know that the purpose of our public services is to assist people with intellectual developmental disabilities, behavioral health, mental illnesses, and substance use disorders, to live productive lives that are self-directed with the goal of independence. And that's why we work together to achieve. That is not an insurance company's goal. And we know from looking at the Affordable Care Act that insurance companies that found themselves with people with prior pre-existing conditions and were very ill are now pulling out of the Affordable Care Act because they're not making a profit. I also know that people that are in our pilot project for dual eligibles, that's not in Oakland County, but in Macomb and Wayne, the UP and the Southwest, those individuals are finding that their medication that they've taken and lived well with is not available in their health plan. Or the provider that they had a 30-year relationship with is not a member of the provider network. So there are downsides to this that I don't know that everyone has considered. And then finally I want to say that there's a whole group of people that we haven't been talking to. When we talk in the public mental health system and the advocacy groups for individuals with disabilities and all of that, public education provides services to people with special education needs and they bill Medicaid for those services. And do you think the HMO is going to go along with supporting the school? I think we're going to find ourselves with a huge 212,000 person problem. So let's think about what, you know, giving over this money, yeah, it gets the state out of the business of sweating the buckets about it. And yeah, you know, they can say, well, they have this service. But I am not sure it will serve us all well. So let's keep our conversation going with these guys up here. Okay.
Good evening. I'm Mark Reinstein from the Mental Health Association in Michigan, the state's oldest advocacy group for persons experiencing mental illness. I'm also part of the statewide Mental Health and Justice Coalition known as Michigan Partners in Crisis. It's wonderful to see so many people here tonight. Fred, the next time you invite me to speak to Oakland Army here, I will expect a crowd this size. The most helpful thing I can probably do tonight is give you a report from the front lines in Lansing regarding the governor's privatization proposal. When that proposal, which by the way was never discussed with consumers, families, and advocates, let me repeat, never discussed with consumers, families, and advocates before it was made. And when that proposal resulted in a flood of complaints to legislators, Lieutenant Governor Calley decided to form a work group on the issue. He appointed 120 people to it. The biggest work group I have ever been on in my life, and yet now I hear it was a small group. The work group met 5 times, ending in June. The work group rejected the governor's proposal and made 28 recommendations for structural and operational matters in publicly funded health care in our state. Included were some things that have been very important to mental health consumers and families for years. For example, open access to Medicaid mental health medications, independent mechanisms for judging consumer and family complaints, improved person-centered planning, greater uniformity of practices and procedures across CMH programs so that people's situations in different parts of the state aren't dealt with unequally, so that someone by dint of where they live winds up better off than someone else in another part of the state. Also, reducing the layers of bureaucracy and duplication that we have in publicly funded mental health care in Michigan, and we have way too many of those layers right now. In July, the Department of Health and Human Services pulled in a small group of people to start looking at next steps, as a report is due to the legislature in January of next year, January 15th. It became obvious to advocates on the new group that the department had little interest in what the Calley work group had produced. The advocacy groups came within a millimeter of dropping out of the new work group, but the Lieutenant Governor intervened, fixed some things, not everything, but some things, and the advocacy groups have remained so far. Now, in this new group, instead of concentrating on critical policy and funding issues, that group is focused solely to date on new types of public meetings the department wants. One type would be for consumers and families. Another would be for service providers. And a third would be for service payers. None of these has been scheduled yet. They want to do consumers and families first. And there's the weekly meeting of the work group tomorrow. Maybe we'll know a date for consumers and families tomorrow, but we don't know it yet. But I do have to say I'm not optimistic about what these sessions will produce. Once the forums are done, the department's work group will have a short amount of time to attempt developing recommendations for the report to the legislature. Once again, I'm not optimistic here. I'm not optimistic that the report will yield meaningful and effective steps for moving publicly funded health care forward in a positive manner that's beneficial to consumers and families. We're in a precarious position. No one knows how it will turn out. But I'm not giving up, and not a single person here tonight, should give up. There is still time for your voices to be heard. Please use those voices. Thank you.
Thank you all. I see we've had a couple more people join us on the stage here, and they introduce themselves.
Yeah, good evening, everyone. First of all, I apologize for being late. It's been a very long day. I came straight from Lansing, but this is an extremely important topic, as all of you know, and I wanted to make sure to be here. Really looking forward to hearing folks' comments and suggestions. I will have more to say as the evening goes on, perhaps, but I don't want to take up time speaking myself. I want to make sure that we're hearing from all the leaders. Like I said, it's been a long day. My name's Tim Greimel. I'm a state representative from Auburn Hills, Pontiac, Keogh Harbor, Sylvan Lake, and Orchard Lake, and I'm also the Democratic leader in the State House of Representatives.
My name is Charlie Robinson. I work for Senator Gregory, who represents this entire area of the state, from Farmington Hills to Hazel Park. He's the minority chair and on the Human Services and Community Health Committees. He's also on corrections, all of which have been heavily hit by privatization. The first stages of privatization, some of the nonprofits here may not want to hear it, were nonprofits, where they took nonprofits and set them up by which you would lower the cost because you would provide the service with fewer benefits to your employees. This new wave of privatization is for-profit companies coming in and saying they can do it even cheaper. The only way they can provide any service cheaper is by raping the employees or raping the benefits. That's what I'm here with.
I've also been joined by a couple of CMH representatives. Will you want to take a couple words? Sure.
I'm Willie Brooks. I'm the Executive Director of Oakland Mental Health Authority. How's that? Good. Very good. So there's a lot of talk as far as why privatization is bad. And I just want to talk very briefly, give you 4 reasons that even though we know it's bad, the question is, why are they proceeding with it? So quickly, I'll give you 4 reasons why they're proceeding, even though we see problems. The first reason is, the Michigan Department of Health and Human Services is grossly understaffed. And there's a lot of pressure on the department to lower their staff, even if it means contracting out and it costs more. So the fact that they're the best entity to handle it because they do not have the conflicts of interest, but they really don't have the people. That is something that we need to address. The second reason why this proposal is going through is the fact that the system is grossly underfunded, roughly by $400 or $500 million, whereas the health insurance agencies are saying that we can resolve your funding issue and actually reduce the cost by $200 million. That is the second reason. The third reason why the proposal is going through is because the insurance companies and the lobbyists, for the most part, have a better relationship with our political leaders. That is true. That's why it is so important to support the political leaders that are supporting us. They need to be able to rely on our support, on our votes, so that they can stand for the things that we represent. Many of these political leaders do not receive a lot of donations from us. And we know that insurance companies have the largest lobbyists in the country. So we must support them. And then the fourth reason why they would allow this proposal to go through even though there's so many problems. It's the simple issue that we've dealt with from the very beginning, and that is stigma. There is a low value for the people that we serve and the people that perform these services. When we say that money is not available, money is being made available to those things that they consider important. One of the issues that we have is that unless you have a direct relationship with some of the people that we serve, you don't understand the importance. Many of the political leaders have never really been to a group home. That's why I commend these political leaders for actually coming out here to learn. So many people do not understand what's going on, and because the low value of the individuals that we serve and the people that work in this field, money will follow that which is value. We have to increase awareness. We have to increase the value of the people that we serve and the people that dedicate their lives to serving the people that we value so that we can have more emphasis on what we do. Thank you.
Yes, hello. My name is Ron Hocking, and I'm from the Detroit Wayne Mental Health Authority. And I want to thank Willie for such an eloquent speech. That was really quite good. And Detroit Wayne basically mirrors that position and the facts that have been stated here. We also want to thank the representatives that have come to hear this. It's very important that you advocate with them. But we basically want to tell you that we commend the efforts of this group, of all your efforts at the advocacy level. And there are a couple articles that we placed copies up at the back where you can see Tom Watkins, our CEO, wrote one of the articles that's in the Michigan Chronicle. And then there's a article from the Dome. So you can see the Detroit Wayne position expressed there along with some interesting commentary. So thank you very much.
Thank you.